Today in this class, we will demonstrate the spleen. Spleen is the largest lymphoid organ developed in the dorsal mesogastrium as multiple lymphatic nodules which fuse to form spleen. Spleen lies covered with the peritoneum. It is present in the left hypochondrium below the diaphragm. The long axis of the spleen lies in line with the 10th rib. It is directed downwards, forwards and medially and moves with the respiration. This fact is very important clinically for the examination of the spleen. We put the hand on the abdomen in such a way that the fingers are directed upwards, laterally and to the left, and we ask the patient to take the deep breath. If the spleen is enlarged, the spleen is felt below the left costal margin with the inspiration. Normally, the spleen is not felt below the costal margin if it is not enlarged. And it is how that the spleen is differentiated from the other lumps in the left hypochondrium. The spleen is although related to the stomach, but it does not form the part of the stomach bed as it is not separated from the stomach by lesser sac. The spleen is having two poles, two borders, two surfaces, two ligaments and a hilum. Now, in this dissection, the anterior abdominal wall has been cut and removed. You can see here the cut ends of the ribs. This is the anterior abdominal wall. Here what you can see is the liver. Here is the stomach, and this is the left dome of the diaphragm. Here is the right dome of the diaphragm. This is the lesser curvature of the stomach. This is the lesser omentum, you can see, and here you can see the greater omentum attached along the greater curvature. This is what you can see is the spleen, which lies below the left dome of the diaphragm. This is the anterior pole, which is broader, and here you can see is the superior border. The superior border shows multiple notches, and at least one notch is nearer to the anterior pole of the spleen. This is what you can see is the transverse colon. This is the left colic flexor. This is the transverse mesocolon, and here you can see the left colic flexor is related with the anterior pole of the spleen. Now, here you can see the spleen has been taken out. This is the distal surface of the spleen. You can see here the anterior border, which is broader. The anterior pole, which is broader, and some people also call it anterior border. This is the posterior pole here. This is the superior border, and the superior border shows multiple notches, and this represents the developmental it represents the spleen which develops from multiple nodules and which have fused to form the spleen. So this development is shown here, that the multiple nodules have fused. This is the inferior border, and here you can see the hilum. This hilum shows multiple openings here, and these openings are because of the passage of the branches of the splenic vessels. Here you can see the splenic vein. This is the splenic artery. Here you can see. Now, the area above the spleen. This is the gastric impression. Here, the spleen is related with the greater curvature of the stomach, and this area here below the hilum, this is the renal impression, and here the spleen is related with the left anterior surface of the left kidney, and this impression anteriorly is the colic impression, and it is related with the left colic flexure. Now you can see the glistening surface of the spleen, and this is because of the its covering of the peritoneum. From the hilum, the peritoneum reflects onto the stomach as gastrosplenic ligament and onto the anterior surface of the left kidney as linorenal ligament. Here you can see the gastrosplenic ligament, that is the fold of the peritoneum, which extends from the hilum of the spleen to the greater curvature, and this contains the short gastric vessels, the sympathetic nerves here, and lymphatics. Then another fold of the peritoneum reflects here from the anterior surface onto anterior surface of the left kidney, forming the linorenal ligament. Here, this is what you can see is the diaphragmatic surface. This diaphragmatic surface is almost smooth, but it shows the impression of the ninth rib, 10th rib, and 11th rib. And the long axis of the spleen lies in line with the 10th rib. Between the 9th and the 10th rib, it is the 9th intercostal space. Between the 10th and 11th rib, it is the 10th intercostal space. So, the intercostal vessels, nerves, and the intercostal muscles, they are all related to the diaphragmatic surface of the spleen. This is the transverse section of the abdomen at the level of the L2 to show the relations of the spleen with the kidney. Here you can see the left kidney, this is the spleen, and here is the linorenal ligament. This linorenal ligament is very important because it contains the splenic vessels, the tail of the pancreas, the pancreatico-splenic group of lymph nodes, the lymphatics, as well as the sympathetic plexus. This dissection has been done to demonstrate the blood supply of the spleen. Here you can see the body of the pancreas is the tail of the pancreas, and here you can appreciate this tail of the pancreas extends up to the hilum of the spleen. The splenic artery here you can observe, which is a branch of the celiac trunk. It is tortuous, and this tortuosity is to allow for the movements of the spleen during respiration. Here you can see the left kidney, which is related here with the renal impression, and here between the two there is a fold of peritoneum, that is the linorenal ligament, and you can see here the tail of the pancreas extends and lies to the hilum and lies in the linorenal ligament. Here what you can see is the left renal vein. This is the inferior mesenteric vessels. And what you can see here, this is the esophagus piercing the left dome of the diaphragm. This dissection you can see This has been done to explore the celiac trunk and its branches. And here you can see the celiac trunk. It is very small, about 1 centimeter in length, and takes origin from the abdominal aorta at the level of the L1. On either side of the celiac trunk lies the celiac ganglia, and which forms the celiac plexus of nerves, which is sympathetic nerves, and gives sympathetic fibers which pass along with the splenic artery and reach to the spleen. Now, here you can see the three important branches of the celiac trunk. The largest one is the splenic artery, which is very tortuous here, you can see. Runs along the superior border of the pancreas, body of the pancreas, and it tortuous to allow for the movements of the spleen during respiration. Now, the artery which is going up and to the left is the left gastric artery, and this artery which is going right and to and up is the common hepatic artery, which divides into hepatic artery proper and the gastroduodenal artery. This is what you can see, the cut end of the first part of the duodenum, and this area is in fact the region of the lesser momentum. And here you can very well appreciate that this is the area of the epiploic foramen. Here you can appreciate the common bile duct, the hepatic artery, and the portal vein, which lie in the right free margin of the lesser omentum. And here the relation is that the portal vein is posteriorly, the hepatic artery is on the anteriorly and to the left, and the bile duct is anteriorly and to the right. Now, this is the splenic vein. You can see this splenic vein receives the inferior mesenteric vein, joins the superior mesenteric vein to form the portal vein, which ascends behind the head of the pancreas, then behind the first part of the duodenum, and then it lies in the right free margin of the lesser omentum. Now, here it is very important that the portal vein drains into the liver. Now, in the cases of the cirrhosis of the liver, the portal vein is compressed, leading to the back pressure in the splenic vein, and this leads to the engorgement of the spleen. So, in the cases of portal hypertension, the spleen is enlarged. The portal venous pressure can be measured by putting a needle in the spleen and measuring the pressure. The points to remember about the spleen are: the superior border is recognized by presence of the notch near the anterior port. The anterior port is broader than the posterior port. The gastrosplenic ligament contains short gastric vessels, associated lymphatics, and the sympathetic nerves. The linorenal ligament contains the splenic vessels, the tail of the pancreas, pancreatico-splenic lymph nodes, lymphatics, and sympathetic nerves. The splenic artery is tortuous to allow movements of the spleen. The lymphatic tissue has no lymphatics. So the lymphatic tissue of the spleen has no lymphatics. So whatever lymphatics are seen, they arise from the connective tissue only. The compression of the portal vein in cirrhosis of the liver causes engorgement of the spleen, leading to splenomegaly. The common causes of splenomegaly are malaria, portal hypertension, kala jar, Hodgkin's disease, and lymphomas, etc. So that is all about the